Hello, good morning, friends. I'm Dr. Mina. I'm pediatrician by profession. आज मैं आपको जानकारी प्रोवाइड करूंगी इन्फ्लुएंजा वायरस और उसके रिगार्डिंग वैक्सीनेशन के बारे में. First of all, what is influenza virus? Influenza virus is a RNA virus and it contributes to infections of the upper respiratory tract infections and lower respiratory tract infection. The cases are more so at the time of seasonal exacerbation. जब भी मौसम में ट्रांजिशन होती है उस टाइम पे जो आप कफ कोल्ड के केसेस देखते हैं वो ज़्यादातर इन्फ्लुएंजा, पैरा इन्फ्लुएंजा, रेस्पिरेटरी सिंसिशियल वायरस एंड अदर वायरसेस की वजह से होते हैं. सो एट द टाइम ऑफ ट्रांजिशन ऑफ द वेदर जो भी सारे इन्फेक्शंस होते हैं, जो भी कफ कोल्ड के केसेस होते हैं, इट्स मोस्टली बिकॉज ऑफ वायरल infections and very less often it's because of the bacterial infection. It can be secondarily only. So influenza virus क्या करता है? Influenza virus की वजह से there is cough, there is cold, rhinitis, running noses there, conjunctivitis is there is high grade fever, and in severe cases it can lead to bronchiolitis, the pneumonias and the croup in the younger children. Now, how does it spread? How does influenza infection spreads? Influenza infection spreads as a result of inhalation of the droplets which are suspended all around in our environment containing the viral particles. And these viral particles are shed by the persons who are infected at the time of coughing or sneezing. So, जो भी particles as a result of the infectious agents in our environment, when we inhale those particles, it results in the influenza infections. Now regarding the prevention. अब prevention कैसे होती है? सबसे पहले we have to follow the proper personal hygiene measures. We have to follow the cough etiquette. We have to stay in isolation and keep the person in isolation. Those who are actually affected, we have to we have to eat healthy food, drink plenty of fluids at the time of infection, and the second is by means of the vaccination. Now, what are the recommendations for the vaccines and what are the vaccines for influenza virus actually? For influenza virus, we have two types of vaccines. One is the inactivated influenza vaccine, the other one is the live attenuated influenza vaccine. अब जो inactivated influenza vaccine है, that is either trivalent or quadrivalent, means it gives protection against either the 3 strains of the influenza or the 4 strains of influenza virus. Mostly currently we are using the one which provides protection against the 4 strains of the influenza virus, the quadriflu. It is available in the market with the names of flu quadri and vaxiflu 4. The dose is 0.5 ml and it is to be administered IM preferably in the right upper arm. Right. Now, what are the recommendations for inactivated influenza vaccines? Indian Academy of Pediatrics recommends the administration of influenza vaccine, the inactivated influenza vaccine, after the age of 6 months till the 59 months of age, to all the children between the 6 months to 59 months of age. Right? Although this vaccine is not included in our national immunization schedule. Firstly, 2 doses are to be given. The doses are to be given. First dose and 2 doses. 2 doses to be given, and there has to be a gap of 4 weeks between the 2 doses. Thereafter, annual vaccination is to be given. That means every yearly the child need to be vaccinated against the influenza virus. Now, one is the healthy children between the 6 months to 59 months of age who are to be given the vaccination. The other one is who are high risk patients. Who are the high risk patients? Those who are having asthma, those who are having cystic fibrosis, those who are having congenital heart diseases, those who are having chronic heart diseases, those who are having chronic kidney diseases, those who are on immunosuppressants, those who are on steroid therapies, those who are on uh, all those patients who are actually suffering from the chronic illnesses, they comes under the high risk groups, and they are to be given the vaccination against the influenza virus. So second, we'll talk about the second one. The second vaccine is your live attenuated influenza vaccine. It is available as a nasal spray, and its recommendation is between the age of 2 years and 49 years of age. It is recommended in all the healthy individuals between 2 years to 49 years of age. The second is, it is to be given to healthy individuals, those who are the care providers of those who are suffering from the high risk illnesses, to the care providers, to the healthcare workers. What are the contraindications of influenza vaccines? First is that the live attenuated influenza vaccines, and we'll talk in general the contraindication. One is those who have developed a severe allergic reaction or hypersensitivity reaction on previous influenza vaccination. They are not to be vaccinated again. The second is those who are having egg allergy. They are not to be given. For live attenuated influenza vaccines, what are the contraindications? First of all, it is not to be given in less than 2 years and more than 50 years of age. It is not to be given in pregnant women. And then it is not to be given in those who are on aspirin or those who are on salicylate therapies as a result of the risk of the Reye syndrome. And to the high risk groups. To high risk groups, we are not supposed to give live attenuated influenza vaccine. For high risk groups, that is the patients who are actually suffering from the illnesses, they are to be given inactivated influenza vaccines. But those who are the care providers of the high risk groups, they are to be given live attenuated influenza vaccines. Now, what are the side effects of influenza vaccine? It includes, there can be mild fever, there can be soreness at the site of the injection site, right? Then the second is, it has to be, there was a case, and the side effects are only present in 3 to 5% of the cases. There was a case reported with the live attenuated influenza vaccine of Guillain-Barré syndrome way back in 1976 as a result of following the influenza vaccination. So that's all. I hope I am able to clear all your queries and all your I'm able to provide all the information regarding the influenza vaccination.